Have you ever felt a new ache in your joints or forgotten where you placed your keys and immediately thought, "Oh no, is this a sign of something serious?" If so, you're not alone. Society often makes us feel like every little change in our body is a problem that needs fixing. But what if I told you that some of these so-called diseases are just natural signs of aging, completely normal, not something to fear? In today's video, we're going to debunk the myths surrounding 7 common conditions that often make us worry. Instead of panicking or rushing to unnecessary treatments, you'll learn to recognize what's just a natural part of aging and what truly needs medical attention. Understanding these changes isn't about ignoring your health. It's about embracing your body with wisdom, confidence, and self-care. You've made it this far in life. Let's make sure you continue to enjoy it with peace of mind. So, before we dive in, take a deep breath and remind yourself, aging is not an illness. And if you're excited to learn more, be sure to like this video and subscribe so you don't miss any valuable insights. Now, let's get started. Number 1. Memory decline. You walk into a room, stand there for a moment, and suddenly forget why you even came in. Or maybe you set your glasses down somewhere, only to spend the next 20 minutes retracing your steps trying to find them. Sound familiar? If so, take a deep breath. You're not alone. These little lapses in memory are incredibly common as we age, and they are not necessarily a sign of something serious like dementia. In fact, most of the time, they are simply part of the brain's natural aging process. Our brains, much like the rest of our bodies, experience changes over time. The number of neurons gradually decreases, and the connections between them become less efficient. This doesn't mean we are losing intelligence or that our cognitive abilities are deteriorating beyond repair. It just means that retrieving information might take a little longer. Think of it as a well-used filing cabinet. The information is still there, but the folders may not be as neatly arranged as they once were. Take, for example, Margaret, a 74-year-old retired teacher. She noticed she was frequently struggling to recall words mid-sentence, something that never used to happen in her classroom days. She feared the worst. Was this the beginning of cognitive decline? But after speaking with her doctor, she realized it wasn't about memory loss. It was about processing speed. The brain, like a seasoned storyteller, takes its time weaving thoughts together. The words were there, just taking a little longer to surface. The good news? There are many ways to keep your brain sharp and slow down memory decline. Engaging in activities that challenge the brain, reading, writing, solving puzzles, or even learning a new skill, can strengthen cognitive pathways. Physical exercise is another crucial factor. Regular movement increases blood flow to the brain, nourishing brain cells and helping them function efficiently. Even something as simple as a daily walk can make a difference. Social engagement is equally important. Conversations, laughter, and meaningful connections help keep the mind active. Isolation, on the other hand, can accelerate cognitive decline, making it essential to maintain relationships and stay involved in the community. So the next time you misplace your keys or forget what you were about to say, don't panic. Instead, see it for what it is, a normal part of aging. Your brain is still powerful, still capable, and with the right habits, it can remain vibrant and strong for years to come. Number 2. Prostate enlargement. Prostate enlargement, also known as benign prostatic hyperplasia, BPH, is one of the most common conditions affecting aging men. The prostate, a small gland responsible for producing seminal fluid, naturally increases in size over time. This growth is a normal part of the aging process, and while it might sound concerning, in most cases, it does not lead to serious health issues. Many men experience some degree of prostate enlargement as they grow older, but for the majority, it remains a mild, manageable condition rather than a cause for alarm. A common misconception is that prostate enlargement inevitably leads to severe urinary difficulties. While it's true that an enlarged prostate can sometimes press against the urethra, the tube responsible for carrying urine out of the body, this compression is usually gradual and mild. Some men may notice subtle changes, such as needing to urinate more frequently or feeling an increased sense of urgency, but these symptoms are often mild and do not significantly interfere with daily life. More importantly, BPH does not equate to prostate cancer, nor does it automatically result in complications that require aggressive medical intervention. For many men, prostate enlargement progresses so slowly that they may not even realize it's happening. In fact, some may never develop noticeable symptoms at all. Even in cases where urinary symptoms occur, lifestyle adjustments, such as reducing caffeine and alcohol intake, staying hydrated, and practicing good bladder habits, can make a significant difference. Regular checkups with a healthcare provider can help monitor any changes and ensure that the condition remains manageable. For those who do experience moderate to severe symptoms, there are effective treatment options available, ranging from medications that relax the muscles around the prostate to minimally invasive procedures that relieve pressure on the urethra. However, for most men, BPH is simply a part of aging, not a dangerous disease. If you are a woman over 65, you may wonder why this topic is relevant to you. The truth is, many women find themselves as caregivers or supportive partners to men dealing with prostate-related issues. Understanding that prostate enlargement is often a benign and manageable condition can help ease unnecessary worry and allow you to encourage the men in your life to seek regular health checkups without fear. Aging comes with many changes, but knowledge and perspective can make all the difference in facing them with confidence and peace of mind. Number 3. Blurred vision. As we age, it's common to notice that our vision isn't as sharp as it used to be. You might find yourself holding a book at arm's length just to read the words clearly, or struggling to focus on details that once seemed effortless. Blurred vision is one of the most prominent signs of aging eyes, and while it can be frustrating, it's often a completely normal part of getting older. The natural aging process affects the elasticity of the eye's lens, making it harder to adjust focus between objects at different distances. This condition, known as presbyopia, typically begins in midlife and becomes more noticeable over time. By the time we reach our 60s and 70s, these changes can make everyday activities like reading, working on a computer, or even recognizing faces in dim light more challenging. Many older adults assume that blurry vision is something they just have to accept, but the truth is, there are several ways to manage it effectively and maintain eye health well into later years. One of the most critical factors in preserving vision is nutrition. A diet rich in vitamins and antioxidants plays a fundamental role in eye health. Nutrients such as vitamin C, vitamin E, lutein, and omega-3 fatty acids have been shown to slow the progression of age-related vision changes. Leafy greens, citrus fruits, nuts, and fish are all excellent sources of these essential nutrients. Staying hydrated is also crucial, as dehydration can cause dry eyes, which can further blur vision and create discomfort. Regular physical activity is another essential aspect of maintaining eye health. Exercise helps improve circulation, which ensures that the eyes receive adequate oxygen and nutrients. This can be particularly important in preventing conditions like macular degeneration, a leading cause of vision loss in older adults. Activities such as walking, yoga, and gentle strength training contribute not only to overall well-being, but also to the longevity of healthy vision. Perhaps the most important step in protecting eyesight as we age is scheduling regular eye exams. Many vision problems develop gradually, and without routine checkups, they can go unnoticed until they reach advanced stages. Conditions such as glaucoma, diabetic retinopathy, and macular degeneration often have little to no early symptoms, yet they can cause significant damage if left untreated. A comprehensive eye exam allows eye specialists to detect these issues early and recommend appropriate treatments to slow their progression. Beyond the natural aging process, several external factors can contribute to worsening vision. Genetics plays a role, meaning individuals with a family history of eye diseases should be especially proactive in caring for their eyes. Past eye injuries, even minor ones, can lead to long-term complications that manifest later in life. Additionally, chronic health conditions such as diabetes and high blood pressure are closely linked to vision problems, emphasizing the need for overall health management. Environmental factors also have a significant impact on eye health. Prolonged exposure to ultraviolet UV rays without adequate eye protection can increase the risk of cataracts and retinal damage. Similarly, the blue light emitted from digital screens can contribute to eye strain and discomfort, making it important to wear sunglasses outdoors and use blue light filters on electronic devices. Simple adjustments, such as taking breaks from screen time and ensuring proper lighting when reading, can make a substantial difference in reducing eye fatigue. While blurred vision is a common and natural part of aging, it does not mean losing independence or giving up on clear sight. By staying proactive with proper nutrition, exercise, eye care, and protective measures, it's possible to maintain strong, healthy vision for years to come. The key is not to dismiss changes in eyesight as an unavoidable decline, but to recognize them as manageable signs of the body's evolving needs. Taking control of eye health now ensures that daily life remains enjoyable, with the ability to see and appreciate the world with clarity and confidence. Number 4. Osteoporosis. Osteoporosis is often called the silent disease because it progresses unnoticed until a sudden fracture brings it to light. This condition, characterized by a gradual weakening of the bones, is particularly common among older adults, especially postmenopausal women. As we age, our bones naturally lose density, becoming more fragile and susceptible to fractures. This occurs due to a decline in calcium absorption and hormonal changes, particularly the decrease in estrogen, which plays a crucial role in maintaining bone strength. While osteoporosis is a natural part of aging, understanding its risks and taking proactive measures can significantly reduce its impact. One of the most concerning aspects of osteoporosis is that it often goes undiagnosed until a fracture occurs. A minor fall, or even routine movements like bending over or lifting an object, can lead to breaks, particularly in the hip, spine, and wrist. Hip fractures in particular can severely impact mobility and independence, often requiring surgery and long-term rehabilitation. Vertebral fractures can result in chronic pain, a stooped posture, and reduced quality of life. These complications highlight the importance of maintaining bone health before problems arise. Several factors contribute to the development of osteoporosis, some of which are unavoidable, while others can be controlled. Aging is a major factor, as bone density naturally declines after peaking in early adulthood. Women are at a significantly higher risk, particularly after menopause, due to the drop in estrogen levels. Other risk factors include a family history of osteoporosis, a small body frame, a sedentary lifestyle, smoking, excessive alcohol consumption, and poor nutrition, especially diets lacking in calcium and vitamin D. Addressing these modifiable risk factors can make a substantial difference in bone health over time. Preventing osteoporosis requires a comprehensive approach that includes diet, exercise, and lifestyle choices. A calcium-rich diet is essential for strong bones, with recommended daily intake ranging from 1,000 to 1,200 milligrams depending on age and gender. Calcium can be found in dairy products like milk, cheese, and yogurt, as well as in leafy greens, almonds, fortified foods like orange juice and cereals, and certain fish like salmon and sardines. However, calcium alone is not enough. Vitamin D is equally important because it aids in calcium absorption. Exposure to sunlight, fatty fish, and fortified dairy products are good sources of vitamin D, and supplements may be necessary for those with deficiencies. Exercise plays a vital role in maintaining bone strength and preventing fractures. Weight-bearing exercises such as walking, jogging, dancing, and resistance training stimulate bone formation and help maintain bone density. These activities create healthy stress on the bones, encouraging them to rebuild and stay strong. Experts recommend at least 150 minutes of moderate intensity exercise per week, along with muscle strengthening activities at least twice a week. This type of physical activity not only benefits the bones, but also improves balance and coordination, reducing the risk of falls that can lead to fractures. Regular medical checkups are crucial for monitoring bone health, particularly for those at higher risk. Bone density scans, such as the dual energy X-ray absorptiometry DEXA test, provide valuable insights into bone mineral density and can help detect osteoporosis before a fracture occurs. Early detection allows for timely intervention, whether through lifestyle modifications, dietary adjustments, or medications that slow bone loss and promote bone formation. While osteoporosis is a common condition among aging adults, it does not have to lead to debilitating fractures or loss of independence. By taking proactive steps through proper nutrition, regular exercise, and medical monitoring, individuals can significantly strengthen their bones and maintain mobility as they age. The key is to recognize osteoporosis as a manageable condition rather than an inevitable consequence of aging. Strong bones lead to a more active, independent life, allowing individuals to continue doing what they love without fear of unexpected fractures. If you are still watching this video and finding these lessons useful, please comment number 2 below to let me know that you are still watching this video with me. Thank you for your valuable time. Number 5. Nodules. Nodules are one of the most common yet misunderstood occurrences in the aging body. These small, abnormal growths can develop in various tissues and organs, including the lungs, thyroid, liver, and even under the skin. While the word nodule may sound concerning, it is essential to recognize that not all nodules indicate a severe health issue. In fact, many nodules are completely benign, caused by factors such as inflammation, hormonal fluctuations, or the natural aging process. Understanding their nature and learning when to seek medical evaluation can bring reassurance and prevent unnecessary worry. As the body ages, structural changes within organs and tissues can lead to the development of nodules. For example, thyroid nodules often arise due to hormonal imbalances or the formation of harmless cysts, while lung nodules may develop from past infections, scar tissue, or minor inflammatory responses. In some cases, nodules form as a result of chronic inflammatory conditions such as rheumatoid arthritis or sarcoidosis. These small growths may remain undetected for years unless found during routine imaging scans for unrelated medical concerns. When a nodule is discovered, either through a physical exam or medical imaging, the first reaction is often fear. Fear of the unknown, fear of a serious diagnosis. However, the vast majority of nodules are benign and pose no immediate risk to health. Physicians take a systematic approach to evaluating nodules to determine whether further testing is necessary. A patient's medical history, along with a physical examination, helps provide context and assess whether symptoms are present. In most cases, nodules are small, stable, and non-threatening, requiring nothing more than periodic monitoring. If additional evaluation is required, medical imaging techniques such as ultrasounds, CT scans, or MRIs provide a clearer picture of the nodule's size, shape, and characteristics. Certain features, such as smooth, rounded edges, often indicate a benign process, while irregular or fast-growing nodules may warrant further investigation. In some cases, a biopsy may be performed to extract a small tissue sample for laboratory analysis, allowing doctors to determine whether a nodule is benign or malignant. While the possibility of malignancy is always considered, it is important to remember that the likelihood of a nodule being cancerous is relatively low, especially in cases where there is no rapid growth or alarming features. For most individuals, the best approach to managing nodules is regular monitoring rather than immediate intervention. Many benign nodules remain stable over time and do not require treatment. However, if a nodule begins to grow, cause discomfort, or exhibit concerning characteristics, medical professionals may recommend further steps, including medication, lifestyle adjustments, or in rare cases, surgical removal. The key is to approach the discovery of a nodule with patience and informed decision-making rather than fear. Communication with healthcare providers is essential in navigating the presence of nodules. Rather than assuming the worst, individuals should seek clarity and guidance from medical professionals who can provide context and reassurance. Regular checkups, imaging scans when necessary, and an understanding of one's overall health condition contribute to effective management. Recognizing that nodules are often just another sign of the body adapting to age can help replace anxiety with knowledge, allowing for a calm and measured response to their presence. Number 6. Insomnia. Falling asleep used to be effortless. When we were younger, it was as simple as laying our heads on the pillow, closing our eyes, and drifting into a deep, uninterrupted slumber. But as we age, many of us start to notice an unsettling shift in our sleep patterns. What was once an automatic and peaceful transition into rest can turn into a frustrating nightly battle, lying awake, staring at the ceiling, wishing for the sleep that once came so easily. If this sounds familiar, you're not alone. Insomnia is a common challenge for older adults, but understanding its causes can help us manage it effectively and reclaim our nights. One of the primary culprits behind age-related insomnia is the gradual disruption of our internal body clock, known as the circadian rhythm. This biological clock governs our sleep-wake cycles, ensuring we feel alert during the day and sleepy at night. However, as we grow older, this rhythm can become misaligned with our daily schedules. Retirement, reduced physical activity, and fewer social interactions can all contribute to this imbalance, making it harder to establish a consistent sleep routine. Psychological stress also plays a significant role. The weight of life's responsibilities may have eased in some ways, but new worries take their place. Concerns about health, financial security, or the well-being of loved ones can linger in the mind. Many older adults find that, at night, when the distractions of the day fade, their minds become flooded with anxious thoughts, preventing them from fully relaxing. This mental tension can make it nearly impossible to drift off to sleep naturally. Physical changes in the body further complicate matters. As we age, hormonal fluctuations can interfere with our sleep cycles. The production of melatonin, the hormone responsible for promoting sleep, declines, making it harder to fall and stay asleep. Additionally, common age-related health conditions, such as arthritis, nocturia, frequent urination at night, or acid reflux, can disrupt sleep, forcing us to wake up repeatedly throughout the night. The frustration of constantly waking up can lead to anxiety about sleep itself, creating a vicious cycle of sleeplessness and stress. It's important to approach insomnia with patience and understanding. Struggling with sleep is not a sign of weakness or failure. It is a natural part of aging that can be managed with the right strategies. Establishing a consistent sleep schedule is one of the most effective ways to combat insomnia. Going to bed and waking up at the same time every day, even on weekends, helps reinforce the body's natural sleep-wake cycle. Creating a relaxing bedtime routine is equally essential. Engaging in calming activities before bed, such as reading, light stretching, or taking a warm bath, signals to the body that it is time to wind down. Making small environmental adjustments can also have a significant impact. A cool, dark, and quiet bedroom can help facilitate sleep, so consider blackout curtains, white noise machines, or comfortable bedding to enhance relaxation. Lifestyle choices throughout the day also play a role in sleep quality. Regular physical activity can help reduce stress and improve overall sleep, but it's best to avoid intense exercise in the evening, as it can have a stimulating effect. A balanced diet is another key factor. Avoiding caffeine and heavy meals before bed can prevent sleep disturbances and digestive discomfort. For those who struggle with a restless mind, mindfulness and relaxation techniques can be highly beneficial. Meditation, deep breathing exercises, or progressive muscle relaxation can help quiet the mind and release tension, making it easier to transition into sleep. Practicing these techniques during the day can cultivate a sense of calm that extends into the nighttime. If sleepless nights have become a source of frustration, remember that you are not alone, and insomnia is not an insurmountable challenge. Small, intentional changes to your daily routine can have a profound impact. With patience and persistence, it is possible to restore restful sleep and wake up feeling refreshed, ready to embrace the day with clarity and vitality. Number 7. Arterial plaque. As we age, our bodies go through countless changes, some more noticeable than others. One of the most silent yet significant transformations occurs within our arteries. Arterial plaque, also known as atherosclerosis, is a condition in which fatty deposits, cholesterol, calcium, and other substances build up in the walls of the arteries. Over time, this buildup leads to the hardening and narrowing of these vital blood vessels, making it more difficult for oxygen-rich blood to flow freely throughout the body. While many people assume this is solely a result of poor lifestyle choices, the truth is that a certain degree of plaque accumulation is simply part of the aging process, much like wrinkles forming on the skin. However, that doesn't mean we are powerless to protect ourselves from its potential risks. Studies indicate that by the time individuals reach their 60s, nearly 100% have some degree of arterial plaque, even those who have lived relatively healthy lives. This doesn't mean everyone will develop serious cardiovascular issues, but it does highlight how common this condition is. The primary concern arises when excessive plaque accumulation starts to restrict blood flow, increasing the risk of heart attacks, strokes, and other cardiovascular complications. Many people don't realize that arterial plaque develops gradually over decades, meaning the choices we make today, no matter our age, can significantly impact our cardiovascular health in the years to come. One of the most alarming aspects of arterial plaque is that it often progresses silently. Unlike a sore muscle or a headache, there are no immediate warning signs until the condition reaches a critical point. Many seniors may feel perfectly fine until they experience chest pain, shortness of breath, or even a sudden cardiovascular event. This unpredictability is why understanding and managing arterial health is so crucial, especially in later life. Take, for example, Helen, a 72-year-old woman who had always prided herself on staying active. She walked every morning, ate what she considered a balanced diet, and had never smoked a day in her life. Yet during a routine checkup, her doctor informed her that she had significant arterial plaque buildup. How could this happen, she wondered. She had assumed that only those with obvious risk factors, such as obesity or smoking, were at risk. The truth is, while lifestyle plays a massive role, genetics, stress, and even chronic low-grade inflammation can contribute to plaque formation. Helen's story highlights the importance of proactive prevention. While she couldn't turn back time, she realized that small, consistent changes could help her slow the progression of arterial plaque and even improve her overall cardiovascular health. She made adjustments to her diet, incorporating more heart-healthy foods such as salmon, leafy greens, and nuts, while reducing her intake of processed foods. She also started practicing deep breathing exercises and mindfulness to manage stress, understanding that chronic stress contributes to inflammation, which in turn fuels plaque buildup. Preventing and managing arterial plaque is not about making extreme sacrifices, but rather about creating a lifestyle that supports heart health in a sustainable way. Engaging in regular physical activity, even something as simple as brisk walking or light resistance training, can significantly enhance circulation, lower blood pressure, and reduce inflammation. For many older adults, staying active is not just about exercise, but about maintaining independence and vitality. Nutrition plays an equally vital role. A diet rich in fruits, vegetables, whole grains, and lean proteins provides essential nutrients that support arterial health. Foods high in omega-3 fatty acids, such as walnuts and flax seeds, have been shown to reduce inflammation and improve cholesterol levels. Meanwhile, limiting trans fats, excessive sugar, and processed foods can help slow plaque buildup and keep arteries flexible. Routine medical checkups are also critical. Many people assume that if they feel fine, their cardiovascular system must be in good shape. However, high cholesterol and high blood pressure, two major contributors to arterial plaque, often present no symptoms until they reach dangerous levels. Regular screenings allow for early detection and intervention, preventing small issues from escalating into life-threatening conditions. A common mistake some seniors make is assuming that taking medication alone is enough to counteract the effects of arterial plaque. While cholesterol-lowering drugs, blood pressure medications, and even aspirin therapy can be beneficial in some cases, they work best when combined with lifestyle changes. Over-reliance on medication without addressing diet, exercise, and stress management can create a false sense of security. One major lesson we can take away from managing arterial plaque is that balance is key. It's not about eliminating every risk factor entirely, because realistically, aging itself is a risk factor. It's about making choices that reduce overall burden on the cardiovascular system. Avoiding smoking and limiting alcohol intake are two powerful ways to protect arterial health. Even those who have smoked for decades can see improvement in their circulation within weeks of quitting. The emotional aspect of cardiovascular health is just as important as the physical. Many seniors experience anxiety after being diagnosed with arterial plaque, fearing that a heart attack or stroke is inevitable. But rather than seeing this condition as a ticking time bomb, it's more helpful to view it as a call to action. Awareness gives us the power to make informed decisions. Instead of feeling defeated, use this knowledge to take small, manageable steps toward better health. Aging doesn't mean giving up on our well-being. It means adapting. Just as we adjust our routines to accommodate changes in mobility or energy levels, we can also adjust our habits to support heart health. By focusing on movement, mindful eating, stress reduction, and regular medical checkups, we can navigate the natural aging process with strength and resilience. The goal isn't to stop aging, but to age with vitality and purpose. Helen, for example, didn't allow her diagnosis to define her. Instead, she saw it as an opportunity to be more intentional about her health. She continued her daily walks, added yoga to her routine, and even joined a local cooking class to learn new heart-healthy recipes. Within months, not only did she feel more in control of her health, but she also felt more engaged and connected with her community. Understanding arterial plaque as a common sign of aging, rather than an inevitable sentence, allows us to approach it with a sense of empowerment. The choices we make today matter, not just for our hearts, but for our overall well-being. It's never too late to prioritize health, embrace positive changes, and enjoy the years ahead with confidence and strength. Thank you for joining us on this journey to explore the 7 common signs of aging and how to navigate them with a calm, proactive mindset. We hope today's insights have not only helped you recognize that aging is a natural part of life, but also inspired you to take better care of yourself in a way that truly supports your well-being. Now, we'd love to hear from you. What resonated with you the most in this video? Is there a lesson that stood out, something you'd like to incorporate into your daily life? Share your thoughts in the comments below. Your story and perspective could inspire others on the same journey. If you found this video helpful, don't forget to like it, share it with your loved ones, and subscribe to our channel so you never miss out on more valuable content. Together, we can build a community filled with knowledge, support, and encouragement as we embrace aging with strength, wisdom, and grace. See you in the next video, where we'll continue learning, growing, and living life with confidence and joy.